when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs.
The lad who was driving got blood coming out of his face.
To save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof. Oh yeah.
He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high drama.
So apparently one's been stabbed in the arm, other in the leg.
You've got a wound up here somewhere, have you?
Yeah, I've got 5 on there.
High stakes.
Where's all that blood come from?
Out of his ear or out of his mouth.
Change of plan, we're going to tube him here, mate. He's arresting, so let's do a bit of CPR.
And high emotions.
I knew I'd hurt myself, but my main priority was the kids.
Which is understandable, really. It's quite a shock to the system when you're involved in a road traffic collision.
It's early evening at the Nostell Air Base, and pilot Owen is preparing to take off into the night.
Alright, I'll have some checks please, I'll put that MVG now. Okay, NV's adjusted and working. Adjusted and working. So is mine. Engines both to fly. Fly, engagement.
Owen's cockpit banter is legendary.
Ooh, that's a good one. Means my landing's gonna be shit. Right, 101, clear, all greens.
Paramedics Paul and Andy are heading south with Dr. Chris to reports of a double stabbing.
Going on to Gogs there. Gogs are working as advertised. But I just need to tweak that way. Right.
Owen's using night vision goggles to see in the dark. Chris is getting updates from ambulance control.
So apparently one's been stabbed in the hand, arm, other in the leg buttock. Okay.
It's happened in Rotherham.
Okay, so nothing to the right, any post left, got them going across. Okay, so commit to this field now. Large field, so if there was a post beside that, I'd know about it. Got a light stanchion behind me, which is the...
We cleared the wires to the rear, but obviously still got those wires in.
Yeah, copied. You can turn it off, I think, if you want to, mate.
Roger.
Off. And... Right, so I've got the wire 12 o'clock, I've got it going off towards the 1 o'clock. I've got the wind as well.
Owen's landing on a patch of waste ground close to a police training school.
Well, this is probably the best place now, isn't it? You can just go across the road there.
And then into
right.
complex.
Goggles coming up then.
Roger.
Okay, got the light stanchion there.
Yep, got
right,
that.
So, Mike, put the atrium in, please, mate. You identify the atrium?
Yep, atrium.
Okay, that's the atrium off, thank you. Just a tiny bit muddy, but it hasn't rained in 3 days, so should be guys. MMI.
So looks good.
Cheers, mate, you're awesome. Right, that's us down then, minute 17.
And we've landed.
So it's landed in the WAF area of Doncaster for reports of 2 people being stabbed. It's not too far from Doncaster. We're just going to shut down and get out and get to sea. Right, we're up in the back. Nobody's approaching the aircraft, which is good. Okay, so engine 1, that's good. Right, the goggles are off then.
Dr. Chris and Andy are heading out across country to meet local paramedics already caring for the victims.
Not as muddy as it looks, is it?
No, it's all right, isn't it?
There might be a big drop, I've got a funny feeling, on the side of it.
Do you reckon?
We're all right.
Just watch your footing.
The crime scene has been sealed off. A taxi driver and his passenger, who's also a friend, are the victims. Apparently it was an attempted robbery by men who were after his takings.
Hi, how we doing, mate? I'll just leave this out of you.
Yeah.
How we doing?
Andy, I'll stay out just for now, all right?
All right, yeah. How we doing?
Right, Luke's got, I think, 4 stab wounds to his leg and buttock. Maybe one what's gone all the way through there, quite a large one there, and one on his buttock.
Okay.
The driver fled the scene of the attack and drove to the police training school for help.
There's been hammers involved, but they're both deny being hit with the hammers. But they've both got stab wounds. Luke, who's the driver, he's sat. He's got 5 stab wounds to the left arm, one to kind of like just the crease of the arm here, anterior axilla kind of location. Can't see wound beds on any of them. Adam has got 4. One looks through and through.
It was a frenzied attack, and it sounds like the 2 men are lucky to be alive.
They said the knife was about this long. So anterior left thigh, and then kind of medial thigh with potentially an exit wound that's smaller than this one, and then left buttock as well. All veins bleeding, all GCS 15.
So that buttock's not hosing, is it?
No.
They can bleed quite a bit then.
No.
Fair enough.
Dr. Chris is an A&E consultant in inner city Hull. He knows wounds like this can be fatal if not treated immediately. The first paramedic to arrive helps staunch the blood.
We've been called to a couple of guys that are alleged to have been stabbed this evening at a separate location to where we are now, and then obviously they've driven away to escape the attackers. We've been contacted obviously to come and give an assessment of them to see what their injuries are. One had walked onto the ambulance, and the other one, who'd been stabbed through his upper left thigh, had been loaded onto the stretcher and taken onto the ambulance that way.
Andy's carried out his own assessment.
So we've got 2 patients. Yeah. We've got Luke laid on a stretcher. Slightly tacky, 105. Blood pressure's OK. He's got some IV powder up. I've asked his mate, what does he look like? And he says, he looks all right. Because I thought he looked a bit pale, but I don't know if it's because of what's gone on, to be honest with you. Adam, who's sat in a chair behind him, he's got about ×5 wounds to his forearm, obviously protective wounds, and he's got ×1 to the axilla delt area. My thought was that, essentially, he'll need to go because he's got some vascular nerve compromise types of, well, nerve compromise. And that one to the buttock could potentially lead to some nasty bleeding.
Well, can I have a real quick gander at that? Sorry, you can keep that, mate. I'll leave it.
Dr. Chris is concerned one of the men's wounds is potentially life-threatening if the bleeding worsens.
Hi, bud.
He wants to see driver Adam's injuries.
My name's Chris, I'm one at Senior Doctors. I'll let you do that. You've got a wound up here somewhere, have you? Yes. Can I have a quick gander where it is that all right, mate?
Just take it off.
It's all right.
It's just
small. Can you just lift your arm out for me a little bit? You've got quite a few there, haven't you?
Yeah, I've got 5 on there.
Put your hand on, lift it right up to the ceiling.
We're all gaping, so
Okay. Which side did they come at you from?
From our left side.
Your side, okay. Fair enough. I think
it looks like front delt, doesn't it?
It does, but you never know.
Yeah, it's got some numbness in that
both.
arm.
Oh yeah. I think. And what did they attack you with?
A knife. A knife.
Little knife, big knife.
I don't know.
Okay. Fine.
In there, it's literally tiny.
It's a massive gash.
Yeah. In his
Yeah. I mean, ultimately, if somebody's coming out from the right-hand side, that could be intrathoracic. So I think MTC. Right. So we're struggling for a second DCA.
And it makes sense just to take them both, doesn't it?
So they want to stay together.
We can make Northern General happy, don't worry.
Right.
Do you
want me to give him a bell?
Ambulances are in short supply, so both men will go to hospital together by road. It means Dr. Chris can deliver life-saving blood transfusion more easily if Adam deteriorates.
You give them a bell. If you have any issues, I'll speak to them.
Well, that's TXA, do you think they need it?
I'll give them both TXA.
Yeah, right, okay.
Hi, it's Andy off the Air Ambulance. I've got a trauma call for you.
They're going to be taken to the Regional Trauma Centre in Sheffield.
They were quite concerned about one of the guys. He's got a wound right on the kind of fold of his arm and his chest. And certainly somebody attacking from the right-hand side, that could well be in his chest. So we'll leave it a couple of minutes to get down to Northern General, which is a major trauma centre with both the patients.
What we're going to do is I'm going to go back in the aircraft and meet the team at Northern. Chris and Andy are going to be in the DCA.
So once we've set off, we'll be about 25-30 minutes. The helicopter will be coming in and landing, but have no patient on board. So is it OK just to inform the security that that's what's happening? Paul, about 10 to 15 minutes before you land. It's about time we get
15 minutes.
15 minutes. About 15 minutes for the helicopter, but no patient. OK.
Get a seat first.
Both of them need to go through to the major trauma centre. Obviously, on a weekend, we need to make sure that we can get them there as rapidly as possible. The ambulance service is really busy at the minute. So what we've decided to do is, although there's a paramedic on the ambulance already, Chris and Andy have gone with them just in case they need any extra support and any critical care interventions that might be required. Because one of them's been stabbed somewhere close to his chest, if that patient goes into cardiac arrest, then Chris and Andy will probably have to do a thoracotomy, which is where they open the chest to get access to the heart and suture any wounds inside and hopefully get the heart restarted again. So it's difficult to do that in the back of a moving helicopter, whereas an ambulance can pull up at the side of the road. So it is a bit more easy to treat sometimes in the ambulance.
As police launch a hunt for the attackers, Dr. Chris and paramedic Andy hit the road. 12 miles away, trauma surgeons are preparing to operate. This will be a long night for the two victims and their families. Every day, the air desk monitors thousands of 999 calls. Dispatcher Pete has a feeling about one of them.
54-year-old has been cycling for 3 hours and has now got chest pain. How old are you? 46. He's there.
The call is coming in from a remote village on the Yorkshire Wolds.
The spider sense is tingling.
Yep, spider senses.
It sounds like a lethal heart attack. He's scrambling Helimed 99 with paramedics Andy and Sammy on board.
Okay, I'll lift a quick power check and there'll be helipad departure over the hangar. Everyone happy? Yep, cool.
They're heading to the area where Dr. Brian lives. His local knowledge could be useful.
Due south of Bolton. Yep, got it there. Bolton and Norton, yeah. There we go. That one. In that village there. Yeah. Medic 99. I'll get a good grid off him.
Receiving, go ahead.
Yeah, mate, couldn't heading towards
Bolton, have you got the grid reference, please?
It's Sierra Echo 03608. Confirmed inferior STEMI by specialist paramedic on scene, over.
A STEMI is medical jargon for one of the most lethal forms of heart attack.
It's confirmed by specialist paramedic.
Yeah, I heard that bit.
Castle Hill's 25 miles away.
From the scene. If it's a specialist paramedic on scene, we don't know if there's a land ambulance over there.
It's a rural area. We'll get right up to it, Sammy. We're only 6 minutes away, and it's not a good driving journey. Okay.
Highly like we're going to take then.
The team are already planning the patient's flight to the cardiac unit at Castle Hill Hospital near Hull.
A gentleman in his mid-50s who is a keen cyclist by the sounds of things, who's developed chest pain and is known to have some risk factors for ischemic heart disease. There's a specialist paramedic on site that said he's actually having a heart attack as we speak.
Helipad 99 Alpha is letting down at the thing.
Helipad 99 Alpha, Roger. CT check.
Pilot Harry's landing his medics in a cornfield just outside the village.
Okay, I've got one domestic there, but I can see where it runs. Yeah, up until that pole there. And now I can see where it's going, it's down the road, so I'm happy with that. Okay, that is LDP. Go up into the corner here. Right, lever is fully down, clear that strap.
Thank you.
A local paramedic has already taken a heart trace from their patient.
Hello, sir.
It's a bit simple chest pain, 5 out of 10, after cycling 50 miles, I think.
Paul Deadman is super fit.
How much you paying now?
1 or 2. 1 or 2. Great.
He was out on a marathon ride from his home in Hull.
We just stick a pair of pads on him.
Do you want to do it on yours?
Castle Hill, yeah, definitely on 2 hours. Castle Hill, have you already spoken to them?
No, I'll leave it to you, I didn't know which one.
All right, so it will be. Is Castle Hill, I'm assuming Castle Hill's my nearest.
It's nearest, whether it's the easiest. It's easiest. Yeah.
Sammy is concerned Paul could go into cardiac arrest at any moment. She wants to apply chest pads that will allow her to shock his heart back into rhythm.
What's your first name again?
Paul.
Paul, I'm Sammy. How old are you?
54.
Fabulous. Thinking inferior STEMI, don't you?
Yeah.
And it started at?
At 12.
12,
We've
30.
done about another 20 mile on top of it.
We were 50 miles into the ride, and my friend just got up this hill and he was complaining of chest pains. So he got off the bike, laid down and then deteriorated. So I couldn't get a phone signal, so I came into this house and then managed to call got to call the ambulance.
Have you felt dizzy at all or anything like that?
When I had my first episode, I just felt a little bit.
Today? Today?
Today,
yeah.
He has had a few issues with his heart in the past, mainly narrowed arteries in his heart.
Right, then we just need to get you onto this trolley.
He's normally quite fit.
Hello, it's Sammy from Helimed 99. I have a 54-year-old gentleman I'd like to bring into you, please.
If you let people know who need to know.
You don't need to speak to your wife.
You don't really want to bother her.
It's worth bothering her.
He's showing inferior STEMI. He's received ondansetron, GTN. He said he's had the full package, so he's had aspirin as well. He is cannulated. His pain score was 4 out of 10 on the crew arrival. He's now saying it's about a 1 out of 10. Our intention is to fly him to you. Thank you. Bye. Bye.
Thank you very much.
Paul doesn't realise it, but they're preparing to resuscitate him in flight if it becomes necessary. The blue board is a machine to deliver CPR.
There's a lot of this stuff is precautionary today, okay? Because when we're flying, we can't really do that much.
I can get on there if you want.
Give us a second or two, just wait for Andy to come round. You ready, Andy?
99, patient 54-year-old male has been accepted for PPCI.
Our ETA will be approximately 12 to 15 minutes.
Yeah, that's all received. You need a secondary transfer, Emma.
Roger, and please may I have a secondary transfer? Over.
This gentleman's having an MI. He's been out cycling. He's pretty fit. Cycles 100 miles a day. But he also has a history of a AAA, so that's a bit of a bulging carbuncle in his main aorta. So time critical, got to go.
Okay, I'm going to lift to the hover, go out into the field, and then it'll be a helipad departure.
Paul's on his way to specialists who will operate immediately to remove the blockage causing his attack using a microscopic grab.
Pedestrian lifted for Castle Hill. He definitely had a heart attack. He's been well for the last 3 or 4 since having the midday. So hopefully it should be an uneventful landing and transfer into Castle Hill where we'll do some interventions to hopefully restore the blood supply to his heart.
At 150 miles per hour, it's taken just 15 minutes to fly from the heart of the Wolds to the outskirts of Hull.
Desk 99 on approach, Castle Hill.
Right, thank you. Your secondary should be in place. Yeah, visual.
Yeah, visual, thank you.
Harry's touching down on the hospital helipad.
There.
It's just a short drive from the cardiac unit.
Desk 99 landed.
Paul's now minutes from treatment.
Right, off we go.
Inside the hospital, a surgical team is on standby. In Sheffield, the victims of a double stabbing are recovering after a total of 14 hours of surgery to repair wounds inflicted by a knife and a pickaxe. For taxi driver Adam, it was a terrifying experience.
I got slashed on my left-hand side a few times around here, and then it comes all the way up here like. It's literally like zigzags all over. I got a punched up through here, and then it was literally pumping up with blood, and then it literally squirting out with blood, pumping up with blood, squirting out with blood.
A man has been jailed for 4 years for robbery, and police are looking for another suspect. The psychological effects were just as serious.
I don't go out half the time. Sometimes I'll go out, but I'm always off the look over my shoulder.
And the attack has made him value family life even more.
At the start of it all, I couldn't pick up my kids at all. I could pick them up with my right hand, I could pick up one of them, but then obviously one will just get left out. But like now, I've like worked at it, I've tried to get it stronger, so now I can actually pick them up, I can throw them up in the air, we can actually play, we can do stuff now, so I actually feel like a dad again now.
It's biking season on North Yorkshire's roads, and hundreds of riders are heading for a cafe near Selby.
Go to the back, clear on the left.
But on a country road, one biker is fighting for his life.
Come through his motorbike V car.
Yeah, he's not very well apparently. Poorly by the sound of it. I don't know if he's breathing.
Yeah.
Certainly wasn't conscious, it says.
paramedics Sam and Pete are only minutes away, with Dr. Jez.
We're on our way to Sherwood and Elmet, which is biking country. It's a nice day today, though it's kind of later on in the year. Reports of a motorcyclist versus a car. He sounds very poorly. In fact, we've just got an update to say he's in cardiac arrest. So we'll get there, assess how he is in terms of does he have injuries that potentially he can survive from. If so, we may run through a kind of process which involves putting a tube in his airway, ventilating his lungs, putting some holes in his chest to relieve any build-up of air pressure that might be there and give him some fluids. It may be doing that we get a pulse back, but generally if patients are in cardiac arrest at this stage after major trauma, the outcome's usually fairly bleak.
They're homing in on a road that is one of the most deadly in the UK for bikers.
It's a bit of luck really or bad luck when you come off your bike as to what you hit. So if you hit something fairly solid that doesn't distribute the forces very easily, you can sustain very significant internal injuries.
Where is it?
I think we're first on scene as well, aren't we?
Pilot Jeff's aiming for a landing metres from the wreckage.
Wind's coming from them anyway, so I won't get too close, but I'll stick it just in front of that FedEx truck. Right. Tail's now clear of the wires behind us, mate. Got wires to my left still. I'll just stick it on these tracks here. There's a wire just to our right, mate. Have you got that? Got that.
Motorists who've been giving the biker CPR are desperate for the team's help.
I'll take suction and primary.
Okay, mate, yeah, I'll take the defib and the secondary. You've got a crew here yet?
Nope.
Good to go.
Right, I'm out.
The high-powered superbike hit a car before its rider was catapulted off.
We'll get a line in him, Sam. Get him tubed in a sec, mate.
Backup is arriving. The biker has a major head injury and his chest is crushed.
Where's all that blood come from?
I think it's coming out either out of his ear or out of his mouth.
Is that brain?
Well, I pulled a load of, when I suctioned out of his airway, I brought something that I'm not sure what it was.
The biker's clinging to life.
Right. Let's do some thoracostomies on him as he is here, Pete. Sam?
Then, his heart falters.
Change of plan, we're going to tube him here, mate. He's arresting, so... Yeah, I'll have a laryngoscope, size 8 tube and a bougie, mate, please. We're going to get a couple of thoracostomies done, Sam. Let's do a bit of CPR. Do you want to come out of the way? He's arrested, mate, so...
The team are starting CPR to keep blood flowing to his brain, at the same time as operating to re-inflate his collapsed lungs, a procedure known as a thoracostomy.
Excellent, so we'll get some adrenaline in and some fluids, and I think he's definitely, right side of ribs are definitely gone, so we'll... Could you just hold a blanket up above my head just to keep that sunlight off him, please?
Dr. Jez is using all his clinical skills to keep his patient alive. He has to think quickly.
He's got a low output state, he's breathing, so... Right, bougie, mate, please.
Now he's going to anaesthetise the biker to keep his airway open. His heart is still not responding.
Yeah, I've not seen that go down, but I think it's in the right place. You got it now, mate? Bougie. Take the bougie out, mate, please. Bit of air in this cuff, mate. Carry on CPR. It's got a low output state. We've got CO2 on there, mate. Yeah, we've got CO2. Good.
Do you want me to move my coat now, yeah?
Yeah, you're fine, mate, now. Right, do you want to do a thoracostomy on that right side, Sam?
Yeah.
At last, his heart is beginning to respond to CPR and a shot of adrenaline, a powerful hormone.
No, right, he's got a central pulse just.
We've got Roscoe.
We have only just, haven't we? That's the thing. Let's just get these done. See if we get an improvement, mate, and then probably yes. Happy where you're going to go, mate? About there, Pete. In that bit there.
Right, just watch your leg and get the scalpel out.
He's not going to be the easiest chaps, I'm afraid, but thank you very much.
They are going to cut holes in the side of the biker's chest to allow fluid crushing his lungs to escape.
It's not going to be easy, Sam, so hit the rib and then just step off it, mate, so you're on top of it.
but the biker's size is making it hard.
You feel the rib?
Yeah, it feels really far in.
It is far in. He's a big boy.
Absolutely miles, isn't it?
Yeah, he's a big boy. So, you get your finger in there, Pete?
Yeah, I've got my finger in.
Lung
I
up.
feel his lung.
Up on that side?
Yep.
Lovely. Excellent. I think we're going to have to... Pete, do you want to just... Please, yeah, I'm going to paralyse him so he stops breathing.
Dr. Jez wants to be able to pump air into his lungs artificially. It would deliver more oxygen to his brain.
Can you feel his lung coming up? You can feel his lung. Lovely, right.
No pulse.
We lost his pulse again. He's got an entitled CO2, isn't he?
Yeah, he's really weak.
Their patient is at death's door. His condition calls for cool thinking and skill.
Did he get any adrenaline in the end?
He's had adrenaline.
He's had a milligram of adrenaline, has he?
He's had one lot of adrenaline, so...
Lovely. Can I have we got some more adrenaline?
The team don't even know who the biker is. His pupils are wide open despite the sun. It's a classic sign of a major brain injury.
So his heart rate has gone up and his end tidals... Go on, so we've got an end tidal. We haven't managed to get a BP on him yet, have we?
Right, he's gone really tacky.
He has gone very tacky, hasn't he?
It's becoming obvious he must have hit something when he was thrown off to cause his multiple injuries.
Yeah, I just want to check he's not going to arrest again in the next couple of minutes, Sam. If he is, then it would all seem...
Dr. Jez needs to understand the mechanics of the accident to be able to predict any injuries he can't see.
So do we know what's happened? Has he just come off and hit, or has he hit a car?
It's a car, I think.
He has hit a car. Oh, he's been coming past this car, or he's just clipped it.
A local paramedic has spoken to the motorist involved.
From the history from the driver,
yeah,
he says he was coming right on the line, looking forwards. The bike was coming up behind him.
Right.
He doesn't know what happened, but he thinks there's something wrong with the tyre of his car, and it pulled him across to the left.
Ah.
And then he doesn't know how he's collided with him, but he has.
So basically, he's hit that back, and then he's.
And then he's sent him off road.
He's obviously gone off the road because his bike's been in the field at some.
Looking at it, I think he's hit that tree.
Let's just go and have a quick look. That would all explain. He's hit something immovable, isn't he?
If he has hit the tree, it's likely he has very serious internal injuries. He needs hospital care immediately. "30 miles away, at RAF Topcliffe, the North Yorkshire Air Base, another case is coming in.
Topcliffe.
Hello, I've got a job for you. It's on the A168 between Thirsk and Northallerton. It's a 3-car RTC, one patient unconscious. Cheers, thank you, bye.
The crew of Helimed 98 are scrambling to the scene.
Do they need some backup? Not at the moment.
Paramedics Lisa and Kit are on the case.
3 takeoffs, please.
Engines best to fly.
Best to fly, and they are guarded.
Confirmed. Doors and harnesses.
Mine's good, my side.
Close and secure rear.
Close and secure front left. Brief.
Let's go. In fact, I'll dial that up first because that's who we're going to talk to. Right, all good. And lefty.
Pilot Chris will have his medics there in less than 5 minutes.
Blanco Douglas, Helimed 98 Alpha, lifting a departing outbound to the north. Blanco Douglas. Yeah, man, round you come, girl.
We're on the way to a car accident. We've been told that there's multiple patients and one of them might be trapped and unconscious, so it's imperative that we get there as quick as we can.
The crash has happened on a main road out of the market town of Thirsk.
I've just seen a DCA. Can you just see?
Going up, but
yeah,
it's
there's
above.
a lorry and a few.
Yep.
There's a bit of standing traffic. We've been to an RTC on here before, haven't we?
Well, it's down here though.
Is that where we were?
Yeah, down below. This is a bit further up.
Looks like there's a DCA just running to it, Kate.
I think you've got people the other side as well.
I think there's some IVs already on scene. I don't know if I think it's police.
Oh, look at that. Just by the truck there happens to be a gate. I think we'll land there. It's going to be a bit muddy, team. Everyone happy where we go?
Yep.
Yeah, this looks messy, doesn't it?
It does look messy. A bad road, this.
I don't know. I've never had a problem on it.
It's chances that just try overtake and stuff in.
Have you got the wagon facing this way on the left-hand side of the road?
Yeah, cheers, Chris.
There's another truck and a patient at 10 o'clock.
Yeah. It's a team, but it's a muddy one. Sorry about that, but this is probably the best bit of ground around as well, all round.
Wreckage is littering the road. A family car has been in collision with a van. 2 children were in the car.
They've hit more or less head on. Speed we don't really know, but it is quite a fast road and there are quite a lot of twists and bends in it, which makes it quite precarious at times. One vehicle had a gentleman in, the other car had a lady and 2 young children. The lady's sort of trapped mechanically because of the impact to the car.
Basically, her pain score is now 7, but she is clinically tender on that splenic region.
Absolutely, fine.
I'm just thinking she's a very, very fit and active woman normally. Is there something?
She's compensating, you're thinking?
Is there something?
Okay.
She is C-spine immobilised, obviously. BPs haven't really changed.
Do you think she'll be able to step out with assistance control and then lie down?
We haven't been.
Rather than pull her?
We could look at that.
Yeah.
The 2 young children are out, sat in bystander cars. One's fast asleep and the other one's sat chatting to a gentleman that was travelling along the road as well. Mum's quite anxious, which is understandable really. It's quite a shock to the system when you're involved in a road traffic collision. It doesn't help the time of year, it's cold, so straight away the elements of the weather start to upset you alongside, the insult that you've sustained and the shock of the collision.
Firefighters are still fighting to free Tamara Kitchen from her wrecked car. The pain she's suffering could be a sign of an internal injury, but Kit is optimistic.
It's a really safe car, there's no intrusion. Don't know what's going to have injured her spleen. She's restrained, airbags, seat belts, no.
Get her out on stretcher and have a proper, yeah. She might just be sort of scrunched up and spasming and all tensed, abdominal muscles tensed up. How are you getting on?
We're just going to get this SAM splint in and then we're going to try the stand and turn.
Right. Me and my daughter were driving to Thirsk. We were following the lady in the white car. First thing I did, I got out and being an ex-military medic, I went and made sure everybody was, checked on the lady with the 2 kids in the car first because I thought it would be more prudent. I'm fine, I've just cut my hand and I banged my wrist and other than that a little bit of shock, but I'm thankful to have walked away unscathed.
It's time to free Tamara.
Do you want me to hold that down for you?
They're going to immobilise her in case of a spinal injury.
Bring your legs down this way, sweetheart, okay?
Initially the crew was sort of saying that they were happy that she was stable with a little bit of abdominal pain but no major concerns, all the rubs were stable.
Fantastic, well done.
They've just asked us to, as they're getting her out, just to reassess her. They're not sure that there might be something underlying, some underlying hidden bleeding, so we'll check her over and take it from there.
How are you feeling?
Hi.
Hello. So what happened, Tamara?
I was driving to my nan's.
Right, so you had your seatbelt on?
Yeah.
Yeah, and the airbags have come out. And could you not open the door as well, so you were stuck in? And as you've just stood up now, whereabouts is your pain?
In my arm.
In your arm, your right arm. Anywhere else?
The one lower tummy hurts.
The bottom of your tummy. Can we have a quick look? Is that all right? Yeah. So what we'll do, we'll have another quick look right from top to bottom of you and just make sure there's nothing that we're missing, okay?
Is it still 8 out of 10, the pain?
It's about a 6.
About a 6. And where is the pain mainly?
Like there where the seatbelt was.
Down across the abdomen.
Tamara is going to be driven to the major trauma centre in Middlesbrough. It's hoped scans will identify what's causing her pain. On a country road in North Yorkshire, the team are struggling to save a biker fighting for his life after a high-speed crash. Dr. Jez needs to know how he came by his injuries.
Yeah, at the moment he's looking really poorly. He's on a big bike, big speed. He has some things hit the tree here, so there's obviously marks on that tree which are fresher. That's probably the bike or the biker, and he's done that. He's got really significant injuries. I'd be survived if he's going to pull through this. At the moment he has barely got a pulse, but he has. So we're going to give him some blood and we're going to fly him to the major trauma centre. But this looks pretty grim, I'm afraid. Well, we'll give him blood then, Sam. Do you want to prep that, mate, and we'll get him packaged to go, and we'll get cracking. Do we think all that blood is from his airway?
From his head.
From his head.
Head and his airway. He's got blood coming out of his left ear, right ear not so much. Blood coming out of his nose. Possibly orbital as well.
Clean behind. I've had
there's definitely a lot of blood in that ear.
They're going to fly him to the major trauma centre in Leeds, 15 miles away.
Hello, it's Jez Pinnell, doctor on Helimed. We're going to be bringing you an adult male trauma. He's a motorcyclist who's collided with a tree at high speed. He was peri-arrest, he still is peri-arrest. He's been intubated, he's had bilateral thoracostomies. We're about to give him blood.
It appears to be mainly head. One pupil below and GCS3 prior to getting his tube down. He may arrest before we get to you, but we're going to be coming by air from Sherburn, so we'll probably be with you in about 20 minutes or so. Yeah. At the moment we haven't got a blood pressure, we've never had a blood pressure. He's got a heart rate of about 110 with a barely palpable central pulse. He's got an end-tidal CO2.
So ready? Ready, steady, move.
Are we okay?
Yeah. Too fast.
You all right here?
Okay, go steady here.
Right guys, so we're going to go to the tail and we're going to come in from our right hand side. So we're going to go basically wheel around the tail, go from the far side of the aircraft. Okay, so head first in guys. So watch your heads.
The team will be working on the biker throughout the flight, ensuring his heart keeps beating. Blood transfusion is being prepared.
095 618 461 227.
Yep, and that looks okay to me. Do you want to check the other unit whilst we're here as well? Well, we'll give him that one for now. Probably give him the other one on the way, mate.
Right, Jeff. Yep. Are you okay to move forward?
Yep.
Yeah, we're in. So, gentleman's basically about to arrest any minute. Quickest way is to get into LGI. He's sustained quite a very serious head injury. He's got lots of blood in his lungs, his airway's shocking. We've got a tube in there, so we're ventilating for him. We've given him some fluid, we've given him some drugs to stop him bleeding too much, and Jez has given him some drugs basically to paralyse sort of what consciousness is left. So it just makes it easier for him to breathe. It's actually less stress on his body. So the idea now is to basically get to Leeds as quick as we can.
It's a 5-minute flight.
Keep an eye on that canyon because I'm just squeezing the blood through, mate.
Yeah.
Pilot Jeff's landed next to a busy airfield.
Quick look behind because we're close to Sherburn and then that'll be all. Oh, looks good behind as far as I can see, mate. Cheers, thanks. He's got an end tidal, so he must have some cardiac output with an end tidal of 4.7.
Yeah. That ECG looks fairly organised.
Yeah, this is all brain failure.
On the roof of Leeds General Infirmary, firefighters are preparing for the helicopter's arrival.
Oh, mate, we're inbound. We'll be with you in a little over 3 minutes. Yeah, copy that. Great one. Come a bit.
Jez is busy pumping donor blood into his patient.
This gentleman is desperately sick. We don't know anything about him. We don't know how old he is. He was riding a very big, powerful motorbike and he's gone to overtake a car. He's collided somehow with the back of the car on the driver's side, and then looks like his bike or him has hit a tree. And that's the issue, that he's hit an immovable object. If he'd have missed the tree and just gone across the field, he probably wouldn't be as badly injured. He's got multiple injuries, and we've put a tube down. We're breathing for him. We've put holes in his chest wall to check that his lungs are both up, and they are. He's had some fluid and some drugs to get his blood pressure a bit better, and we're giving him some blood as well. Hospital are aware that how poor he is, so they'll probably have blood on standby for when we arrive. The main issue, I think, is his head actually, and his pupils are both blown, which is a really bad sign at this stage. So, I think even with a pulse, I think unfortunately his outlook looks terrible.
That's 99 landed LJ.
I think this is all probably head with some blood loss from his base of skull fracture.
Right, mate, go. You ready? Yeah. Okay, yep. Right, someone just watch his tube, chaps. Ventilating 4.6, yeah, good.
Good to go?
Yeah, let's go.
A full trauma team has been called to resus to take over the biker's care.
Hands on the yellow scoop.
Hands on the scoop.
Everybody ready? Okay, ready, steady, and move. Right. Unknown male. I think he's probably in his 50s or 60s, riding a big, powerful motorbike. He's been going for an overtake on a car. He's clipped the back end of the car, and then there's a tree which has clearly been hit by him or his bike. Yep. His bike's then gone into a field, and then he's ended up in the middle of the road. The report was that he was in cardiac arrest. So he was intubated with no drugs. He's had bilateral thoracostomies, both lungs are up. got an output with 1 milligram of adrenaline and a bit of fluid, and has maintained an output, although he's still in a low cardiac output state. Right pupil was blown on scene, both pupils look to be blown now. So injuries, he's clearly got a head injury, he's got some right-sided rib fractures, but his lungs up. Query abdomen, query pelvis, we've put a binder on, his right femur's gone, and we think his right humerus is gone. There was a lot of blood on scene. I think it was mainly from his base of skull fracture. It was coming out his mouth and his ears.
The biker is going straight to the scanner. It's vital specialists can assess his head injury and work out how to stop blood loss in his chest. His life is on the line. It quickly emerges that the biker is 63-year-old Ian Stewart, a semi-retired businessman who'd been married for 34 years to wife Fiona.
I got that knock on the front door and they said, we've been asked to get you to the LGI in Leeds as quickly as possible.
At the hospital, she found Ian on life support.
They came and said that there was no brain activity and asked for our permission to turn the things that were keeping him alive off. If in that moment I could have made a decision for him to live and he would have been stuck in a wheelchair for the rest of his life, and you know, the decision was for him, it wasn't for me and his children and grandchildren that he left behind.
But she's very grateful she was able to sit by her husband's bedside for the last time.
Myself and my 2 children were able to see him in the hospital and talk to him and have them last special moments with him, really, which without the intervention of the doctor and the medical team at the roadside, that wouldn't have happened.
The driver of the car involved was jailed for 7 months after he admitted causing death by careless driving.
She's restrained, airbags, seat belts, no.
Mum of 2 Tamara broke her arm in 2 places and her finger, but her children escaped with bruises in the massive head-on impact.
I knew I'd hurt myself. I could feel it in my wrist. I was in so much pain I couldn't move it. But my main priority was the kids, so when everyone was coming over to try and help me, so I was just like, get my kids, sort my kids out, someone look after my kids.
I have a 54-year-old gentleman I'd like to bring into you, please.
Incredibly, cyclist Paul walked out of hospital 48 hours after his admission for his heart attack.
The fact that I was airlifted has had a huge impact on my well-being. The strength of my heart muscle could have been severely impacted, and of course people can suffer cardiac arrest if the heart attack isn't treated quickly enough. The air ambulance prevented any of that. I don't want to imagine what may have happened if I hadn't have received that speedy response.
When lives are on the line,
Are there any obvious injuries?
these men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The 2 Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high drama.
Van's hit her about 35 mile an hour.
I can't get radial pulse on her.
Obviously got a head injury, being fairly elderly, and she's prone to significant injuries that she's likely to conceal.
She's not responding at all now.
High risks.
He's come off his bike coming home from work.
Where's that hurting, mate? Your back.
Motorcycling into hedge. Appears to be pelvic lower limb injuries currently.
And high anxiety.
Dizziness, left side temporal headache.
They've started the treatment, they've recognised that this patient's got some positive signs of what could be a stroke.
When the sun goes down, the air ambulance team's job gets a lot harder.
Alright, everyone good? Roger. That's on, that's on, that's on. Me1 departure out of here, outbound to north. Roger.
Tonight, pilot Lee and paramedic Matt are responsible for getting HeliMed 98 to the scene of a serious pedestrian accident.
Power. Just letting it settle. Good controls, good authority, continuing up.
The crew of HeliMed 99, the other helicopter, are already there, and it sounds serious.
This lady, Joyce, who's 83, we believe, has been hit by a van. She's hit the bumper, hit the windscreen, and then gone into the road. I'm just looking at the van now, it's a bullseye to the driver's side.
Yeah, copy all that.
Okay, mate, A61, you got that. Obviously, the blue light's in at 12 o'clock, that's where we're aiming.
Roger. So follow the red lights up, blue lights to the right. Where my light is now is probably where that field is.
Yeah.
I reckon.
Okay, so we do have trees. Not sure about the slope. That will be a factor, I think.
Got wires in the middle of that field there.
Yeah,
look.
domestic wires got those. Thank you. So we've got trees in the undershoot. Nothing on the overshoot. No domestics in that one that I can see. And obviously that's where the incident is.
They're circling a busy road out of Ripon.
All good in the back, guys. We've got good rate of descent, good power in hand.
We've got access across.
I'm just looking for that now, buddy. What have you got on the left-hand side?
There's a gap at like 2 o'clock.
We're about
there. Just there, look. I'm just taking the light.
Yeah, got
Yep,
you.
got it.
Okay, mate, so tail's clear to the right, coming to the left.
Lee's aiming for a field close to the crash.
I'm going to get you as close to there. And I think, to be honest, it's going to have to be about there.
What do you want to clear?
Just take the call pods in case we transport.
Yeah, we can stick on our carpools, yeah.
Okay, guys, yeah, we're down.
Dr. Becky is bringing her clinical skills to a desperate battle. To stabilise the 86-year-old victim of the accident, she hit the van's windscreen.
Is this the vehicle that's hit? Yeah.
Hey, all right. Yeah, she's clipped it. She's going over the top.
Their patient was on her way home. Paramedic Andy's bringing Becky up to speed.
She's crossed the road here, and obviously van's hit her about 35 mile an hour.
Okay.
She's obviously bullseyed it and bounced off into the road. Essentially, when we got here, she went back at motor. She's got a laceration above her right eyebrow.
Yeah.
And I think that's she's got a laceration and a bit of bumpage at back on the occiput.
Yeah.
She's not complaining of any pain in her pelvis. Her legs feel all right. She's got nasty skin tears sort of over the tib fib area.
Pensioner Joyce Taylor was crossing the road after getting off the bus. Now she's fighting for her life.
So who was first on scene? There were somewhere. Crew, yeah. And she was alert when you first got here then? Sort of.
She was alert, what we understand, she was alert when she first
Is she?
was on the floor, but then she had a querying episode of unconsciousness.
Right, okay.
Joyce needs emergency surgery.
A Citroen van's hit her at 35 miles per hour.
Andy's alerting doctors at the major trauma centre in Leeds.
No significant sort of injury regards C-spine. She's a GCS of 15, but she believes she may have had an unconscious episode.
Go ahead.
Yeah, Lisa, our intention is to fly this lady to the LGI from where we are, so we're just getting her sorted and we'll get her off the ambulance and onto the aircraft.
Roger that. Have you got an ETA for LGI?
By the time we get her onto the aircraft and fly there, I reckon 30 minutes. Andy's just on the phone to the LGI at the moment, over.
It looks like Joyce may have a serious head injury.
What are pupils doing, Dad, today?
Pupils equal back to me, mate. I can't see any blood in the ears. There's quite sort of blood around the back of the head, but I couldn't feel any bodies. We've dressed the two from
Are we good to start moving towards the helicopter? So we're going to drive to the gap in the hedge and then carry from there.
And we'll put her into the Elizabeth. Ask him to get the Rotherham out as well. Got to do Rotherham, yeah.
I'll run up the road and start getting that done.
Yeah.
It's a cold night, and the team want to warm up their patient. It's been proved cold is a killer in serious trauma cases, as it affects a patient's blood flow.
She's had a bit of an episode where she felt sick, so we've had to rotate her onto her side, which has delayed us a little bit. Her blood pressure might have dropped a little bit as well, and her pulse is a bit fast, which is indicative of sort of a bleeding episode.
But Joyce's condition is deteriorating.
I can't get a radial pulse on her. She's tacky, so I think we can give her some... No, it's going in now.
You definitely want me to radial pulse? You still hearing me all right?
So she's got some access, some fluids if needs be, or blood, but she's going to have to go to a major trauma centre. Just because of her age and the mechanism of injury.
The team are trying to raise her temperature with a body heater, the Gerotherm.
It's a blanking with a heating system in. Basically plug it into a battery that we carry with it. So the idea is we put that on, it heats up, and we're just putting a foil blanket on now called a blizzard blanket. That tied in with the Gerotherm will keep her nice and toasty and nice and warm. The fact that she's elderly, the fact that it's cold, when people bleed, all these things tag together, you know, it's not good. So let's at least stop one thing affecting this patient. If it's the cold, keep them warm.
Time is of the essence. Lee's preparing for a rapid takeoff as soon as their patient is aboard.
Got it, you got it, Andy.
Watch yourselves on the trees. Do you want to pass over, or are you okay?
She's in the
stuff now. A minute. Just lift your foot, watch your foot on that.
You two right there?
Yeah.
Yeah, she's not dropped the GCS really since we've been...
No, that's good, but she's...
Just the only thing is rest rate's come up a little bit.
Yeah.
And that air entry on the right side, I think...
Watch your heads. Up we go, up. All right, put her on, okay. We can peel away, we'll feed her in.
Joyce's heart rhythm is failing, and she's now fading in and out of consciousness.
Joyce?
Yeah.
Okay, right, darling. It's going to be quite noisy for about 15 minutes while we take you to hospital. Okay, you're in a helicopter. Okay.
Yeah, fair.
Joyce, can you remember what happened? Just getting a bit agitated, I think, isn't she?
Pardon? You just lay down.
Have you been to town on the bus? Joyce? No?
Lee can't let the urgency of this case affect him. Taking off at night is fraught with danger.
Also, Trim, he's engaged. It's going to be a lift out of here. Just let it settle down. We have got a little bit of a slope. Okay, power coming in. And that's us breaking away. Okay, mate, just letting it establish itself there. Clear to the left. Yep, no worries. Okay. Okay, up we go. Okay, that's a nice clear area in the 12 o'clock. So any problems, mate, it'll be 12 o'clock into that field there.
In the cabin, the team's entire focus is on keeping Joyce alive long enough to reach hospital.
Pedestrian 98, lifted from Sydney routing to Wilmot.
Okay.
Joyce, you alright, darling? Poor lass.
She's been given drugs, kept warm, and she's been wired up to the defibrillator in case she goes into cardiac arrest.
Got a little bit wild, hasn't she?
Yeah. Joyce has been crossing the road, been hit by a van at about 35 to 40 miles an hour. There's quite a lot of damage to the van, so there's dented the front bumper and there's a big bullseye to the windscreen. She's obviously got a head injury, she's got lots of skin wounds, but being fairly elderly, unfortunately she's prone to some fairly significant injuries that she's likely to conceal and a bit harder to detect because of the medicine.
4 minutes, mate. We'll go for pre-landers early, please. Yep. You okay in the bag?
Yeah, I'm just going to put myself harness back on.
Okay, we're just going to do some pre-landers.
Alright.
Just let us know once you're back in your harness, please, mate.
He's just putting it on now.
Joyce's blood pressure is dropping to critical levels, but she's now minutes from specialist care.
Speed's good, height's good. I'm in the descent. Any issues from now, it will be a committed to land. Roger. Pedestrian 98, on approach to land Elgin. All clear on the right. That's us pretty much over the H. Going down on that. 98's landed. Down.
It's taken just 8 minutes from accident scene to rooftop helipad. Dr. Becky wants to see her put into an induced coma immediately on arrival.
Joyce!
She's definitely dropping her GCS, isn't she? If I give them a ring downstairs while you're unloading, suggest they need to set up for an RSI, is that all right?
Yeah, definitely, I agree.
This lady's dropping her GCS and they're expecting a lady who's GCS 14, so... you get anything out of her, Lee?
No, she's not responding at all now.
GCS is the Glasgow Coma Scale, a system to measure levels of consciousness. And Joyce is barely registering on it.
Joyce! Joyce! Joyce!
The fight to save their patient is being lost, even before she reaches resus. At Leeds General Infirmary, Dr. Becky and the team are racing to get Joyce, the victim of a road accident near her home, into the care of the hospital trauma team.
She's gone from being particularly tacky
to
being quite bratty now.
Yeah.
Joyce's rapid heart rate has now become very slow. It's a very worrying development.
She's just become bradycardic in the lift coming down and she's dropped her GCS to 3. She has no signs of a chest injury.
But she's a peri-arrest trauma.
Yes.
The LGI's trauma team are taking over her case.
This is 83-year-old Joyce, around 4:45. She was crossing the road and hit by a van. The current scene reported that she was initial LOC and then GCS 15. Her air was being intact, she had good air entry. Her rest rate was initially 24, it's now significantly dropped. She's been slightly tachy, and the best blood pressure we've got was about 124 systolic. Pulse is now dropping down to 40, can't get blood pressure, and GCS has dropped significantly.
Right, can you tell me, what time did she drop her GCS?
Literally last 2 to 3 minutes.
Last 2, yeah.
Okay,
yeah.
and what time did she start becoming bradycardic?
In the lift.
Last, yeah, in the lift,
right,
yeah,
okay. So, default positions, we need a tube, and we need to prepare for thoracoscopy so we're proven otherwise. Okay, is she making any respiratory efforts at all? Agonal breathing, and she's posturing, is she not?
Unless the trauma team can stabilise Joyce, her survival is in real doubt.
It changed quite dramatically, really. And this lady was initially talking to us in the back of the DCA, give a full name, give a date of birth and stuff like that. Unfortunately, en route, probably as a result of a head injury, she's become increasingly unwell. Less responsive, not really talking to us, showing signs that she was sort of developing signs of a intracranial sort of problem, stuff like that. So, given her age and the mechanisms, probably not looking for a sort of good prognosis for this lady.
Understanding how her injuries happened is critical.
Was she struck by the van?
Yeah, so there's a big dent on the front bumper, sort of at leg height, and then there's a bullseye to the windscreen at the bottom of the windshield, which I suspect is her head.
Okay.
It's never nice to see a patient sort of go from sort of talking to you to suddenly deteriorating. Unfortunately, that's what happens when you get head injury. Physiology goes to the pot, really. So, but she's in the right place now.
Have we got blood running? Yeah. Right, get that through, please, and let's start internal cardiac massage as soon as we can.
They're fighting to restart her heart by hand.
Have one lot of adrenaline, please, and one lot of dextro.
Matt and Lee can only watch and hope.
Volume-wise, we're going to be going with 2 litres of saline. We've got 2 units of blood. We're going to reassess. If the heart is still not doing anything, I think it should stop. Okay. How you go with that, Gary? I'm not getting anything on the output of that.
But she's not responding. Hope is fading.
So they're trying to exclude any possible reversible cause of this lady being the way she is. So there's a limit to what they can do for her head injury, but they're making sure there's no other injuries that we've missed unseen because it was dark and we're in the back of an ambulance. They're making sure there's nothing else that they can treat in the emergency department before they say that she's got unsurvivable injuries. Everybody gets the maximal effort and absolutely all the care, regardless of their age. We do everything for them and try and see if we can help them to survive.
The evening shift is an opportunity for the team to catch up with admin. Tonight, Gav's stock-taking medical supplies.
Everything has got a manufacturer's use-by date on it, so really if you end up using a piece of equipment that was past its date, you're not really complying. So just make sure that we're on top of everything, everything's in date and ready to go when we need it.
But a 999 call is about to end the admin.
This guy's got that what 3 words. Is that going to help?
Dispatcher Tyrone is alerting the duty crew.
Come to the ops room, please. It's a motorbike crash and they all seem a bit panicky, but it's in the middle of nowhere.
Does everyone appear to be completely awake?
The camera show on the way there.
He is in quite a lot of pain.
So Emmy's working.
Working and adjusted, yep.
Yep, we're working 2. Engine above the fly.
Fly engaged. Okay. Oh, I'm getting better at this takeoff slack. Right, okay. Just coming backwards for my marker. And whereabouts are we going to? Some apologies.
The M1, M18 interchange.
Okay, good. Is it on the motorway itself or on the B road?
It's on a B road.
Okay,
It's
Rotherham.
It's a short flight for pilot Owen.
7 minutes.
Dr. Steve is preparing for a serious injury.
We've been listening to a call as it's come through that there's a motorcycle that's crashed off the road in a rural area. The initial call, it said the patient was in a hedge and not moving, but then a second caller said that injuries to the legs and pelvis. Given that it's a motorcycle on a dark winter's night, the injuries could be substantial. It's quite wet out there on the road, so it could well have been a loss of traction or a skid that's taken the rider off the road. But what's most concerning about this is the initial caller said the patient wasn't moving, so the injuries could be serious.
This mission will mean a difficult landing in the dark, and rain is falling.
The weather over the recent days has been pretty horrendous actually. We've had some really severe rainstorms, flooding. There's a lot of standing water out there. There's also a lot of debris that's been washed from the fields and the surroundings onto roads, so there's a lot of grit, a lot of mud. So driving conditions out there are particularly challenging. Even coming in this morning it was quite difficult in some sections, so you should imagine a rural road in the darkness is going to be particularly risky.
Right, so blue lights are on the B road north of the junction, or north east of the junction, so it's where we expect it to be.
That's where we're going. Looks like we do have some power lines running across where we're going.
Mate, 200 footers to the south, I believe they were, but we'll have a good check when we get there.
Yeah. Okay, we'll get these looped.
Cheers, mate.
The team are using night vision goggles and a steerable searchlight to find a landing site, but there are many obstacles that could cause a crash.
Trees on the undershoot, pylons on the far left of the field.
Okay. Right, we are into wind. It's a massive field. There's no hoses nearby, so there's going to be no typhoon wise, so that's all good. No. So size, shape, surround, surface slope, we're happy with all those. Yeah. So we are into wind then, so have a quick look around then. Everything's fine. No slope here, it does look fairly firm.
Owen is gently easing Helimed 99 down.
It looks like it might be something at 12 o'clock, mate, over that burn block, yeah? But take your head torches and things like that.
Yeah,
okay, don't need the A-trim because it looks very flat and firm.
Perfect.
Okay, and I'll put the trim bullet away. Right.
Hey, tail is good.
Cheers, mate.
Right.
5-0 for landing.
In a roadside ditch, local paramedics are treating biker Ryan Collins.
Hey guys. Alright. How are we doing? Steve and James from Air Ambulance. Oh yeah.
So we've got Ryan, 43. He's been going down a motorbike about 50 miles per hour, hit some mud. Yeah. And it sounds like he's skidding into here. Not moved since.
Okay.
Initially complaining of pain, pelvis, right lower back, and in his chest as well. He says the pain in his hips more to the right hand side now.
Okay.
But we're just going to we're just trying to get blood pressure, and the pulse rate of about 80, but we're not been able to get a SATs as yet.
Okay, fine. So let's have a look at his position.
Dr. Steve fears a spinal injury is causing Ryan's numbness. The team must take great care not to worsen it.
Hey buddy. Steve on the docks on the aircraft. You normally fit and well?
Yeah.
Do you take any medicines for anything?
No.
Allergic to anything?
No.
Where's the worst pain at the minute?
My hip, right hand side and my left leg at the bottom.
Okay, I'm just going to check you over top to toe. My colleagues have done a great job. Pain in your chest at all?
Just a little on the left hand side, but it's where I'm laid on it, I think.
Okay, and if you take a deep breath, does that catch you at all?
Ryan was riding home from his office job when he came off on a slippery patch of road. Dr. Steve needs to examine him, but that's almost impossible here.
So what we'll do then is we've got like a special stretcher that we put behind you. We're going to roll you flat back onto it, get you on the stretcher and get you in the back of the ambulance so it'll be a bit warmer and drier. Okay, buddy?
It's this thing there.
Some twiggage.
Yeah.
Okay, we can work around that.
He needs gentle handling.
Can you just do me one favour? Can you just grab his head while I swap hands? Because if we're going to roll, I need to get my hands at the other...
That's fine. Have you got any pain in your neck at all?
Oh, at the back.
Okay, fine. Yeah. I've got it, yeah. Yeah, I have control.
As soon as Ryan's helmet was removed by his rescuers, he was fitted with a neck brace. His girlfriend Sonia has arrived to support him.
He's come off his bike coming home from work. He's hit some mud. There's quite a lot of mud on the floor. So, and I was at home. I lived like 2 minutes away, so he's phoned me first.
Okay, your call at the top with the head then.
Right, is everybody ready? We're going to go on go. So it's ready, steady, go.
Okay, well done.
I've got the stretcher on this. I've got the scoop on this side.
That's it. Arms across your middle if you can.
Where's that hurting, mate? Your back. Okay, mate.
Okay, let's just get the scoop, and if we can bring the scoop up and to where. That's it.
Nice.
Good.
Just support it on this side.
Yeah, that's it. We're nice and flat there. Right.
Ryan's pain suggests internal injuries. Dr. Steve's not yet satisfied his patient is out of danger. By the side of a busy road in Rotherham, Flying Dr. Steve is anxious to examine injured biker Ryan, thrown from his motorcycle into a hedge half an hour ago.
Yeah, update. Young male, as described, motorcycle into hedge. Appears to be pelvic lower limb injuries currently, conscious and breathing, blood pressure 150/90. Current intention is to get him onto the back of the DCA, carry out a fuller assessment out of the elements, and we'll decide from there if we need to travel or which hospital he's going to, but we'll update you when we've made that assessment over.
Is everybody ready?
Yeah.
On go. Ready, steady, go.
Right, that's it. We got him.
Yeah, over.
You all right, buddy? We've got you. We've got you.
Ryan's being loaded into a heated ambulance after a long time lying in the bottom of the hedge.
Okie dokie, there we go. We're out of the rain now, buddy. Life's going to get a bit more better. Okay, we're going to have a look at your top to toe again now we're in the...
Okay.
Okay. Let's just unzip you. We didn't want to do that whilst we were at the side of the road and in the rainstorm, so that wouldn't have been very fair.
Ryan's a two-wheeled commuter, and it looks like his biking gear may have saved him from even worse injuries. Now, though, it's got to go.
We're going to need to get these trousers off you, okay, to have a look at where your hips are hurting.
Is it still hurting in your hips, buddy?
Yeah.
Yeah, all right, mate. We're going to have to cut your trousers off, I'm afraid, all right. Okay, mate. Which side's the worst? The right-hand side that I'm touching now? Okay, what about this side? Is that painful?
They're trying to rule out a fractured pelvis. It can cause lethal internal bleeding.
Is it hurt down here on your hip bones?
Not on the bones, right at the back, right where it's off the back.
Okay, that's fine. I won't push any further, but I think we need that binder on and that.
I'm just going to cut down to your undercrackers, mate. All right, we'll keep you decent, okay.
The tight pelvic binder will stop broken bone fragments moving and puncturing blood vessels or nerves.
Just going to get snug around your hips, this little binder, okay. Sweet, okay, put binders on. Let's get another BP, now we're here, and we think about access.
If Ryan is bleeding, they should be able to see his blood pressure dropping.
We're queering pelvis, so we'll give him some TXA, morphine, we've got blood pressure that would support that. Get some access.
We'll give you some pain relief in a minute, buddy, all right? Mate, just lift this arm up for me. Lovely.
I'm going to pop a little drip in on the back of this hand, okay, and then we can give some pain relief through that. Okay, Ryan?
Now he's out of the cold, he's becoming more stable.
Ooh, sounds a wild night out there, doesn't it? Okay, scratch and a push coming up on this hand now.
Do you want some morphine?
Yeah, we'll go for some morphine. I think we've got a decent BP, so...
He's being given a drug that promotes blood clotting.
Okay, I'll take the TXA from you first. So... TXA at 1907.
Paramedic James is trying to identify a fracture, but it's hard to track down.
Definitely no pain when I'm pressing around there at all.
There's a little bit at the bottom.
A little bit at the bottom, sort of around where your bladder is, round here? Yeah, okay, mate. Any pain around the back, yeah?
That's what hurts.
Okay,
on this side, yeah.
This side, the side that I'm touching now, and is it where my hand is or is it lower?
Round about where your hand is and a little bit lower.
Okay, more kind of here?
Yeah.
Yeah, so it's kind of lumbar and then back of his pelvis, top of his pelvis, really.
Okay, so position to be able to start moving soon, I think. Okay, I've given you some painkiller now, Ryan. You should start feeling a bit better soon, okay.
Ryan needs scans, and that can only be done in the major trauma centre in Sheffield, 10 miles away.
Whilst he may have an injury to his pelvis, his blood pressure, his heart rate are stable. He's breathing quite easily. He has got some discomfort in his chest, but there's no obvious significant chest injury. It's difficult to tell in the pre-hospital phase at the bottom of the ditch where it's dark and rain-lashed. But his numbers just now are stable. So, having helped the crew get him packed and wrapped, they can take him through to the Northern General for further assessment. You'll need to go through the trauma CT, so we can find out exactly what's going on with his chest, his abdomen and his pelvis. But once they've done that, we'll have a better idea of his injuries.
Nice to meet you, buddy. Hope you're feeling better soon. All right, these guys will take you up to Northern and get you seen to. All right, all the best.
Ryan's being driven to the trauma team. Flying in the dark is risky, and it's safer to go by road than expose him to the hazards of a nighttime takeoff.
So a patient's been coming down the road on the motorbike, hit a patch of mud and come off, ended up in the ditch. He wasn't knocked out.
James is alerting the Northern General Hospital.
Patient appears hemodynamically stable. He triggers step 2 of the major trauma triage tool. He's got a little bit of pelvic pain, so we've put a pelvic binder on. And plan is for crew to convey, and we're going to come clear. It's a paramedic crew, and they're happy to deal.
But there's no safe ride home for the team. They're reversing out of the field where they landed. There's no such thing as a routine takeoff at night. In Yorkshire's remote dales, thousands of families live more than an hour from a major hospital.
We'll lift to hover clear area departure across the airfield.
And when there's a medical emergency, the air ambulance becomes a local lifesaver.
Pedestrian 9 lifted Ripon Bay Bridge.
Pilot Harry is flying Lisa and James to a serious case in Wensleydale.
We've just been tasked from Tottenham. We're on our way to Bainbridge in North Yorkshire. It's a crew request for a patient that's triggering on our stroke bypass. So crew have got to the scene, they've assessed this patient and they've noticed that they've got some, they're fast positive. So there's some obvious signs that the patient's suffering from a stroke. Similar to a heart attack, delay in time causes death to muscle, and that's the same with a stroke. So the brain's being starved of oxygen and therefore brain tissue is dying. So the quicker we can get them to specialist care, the better for the patient and obviously less damage that's caused.
Local paramedics have already told doctors at the regional stroke unit the patient is on his way.
How old is it, does it say?
76.
Right.
Being accepted with dysphagia.
Right, okay.
What's that?
Difficulty swallowing.
Patient could be able to mobilise, so it could be something more subtle, but the crews have picked up on positive signs that the patient's being accepted at James Cook in Middlesbrough. It's a good hour transport by road, whereas we could probably do that in 20 minutes, so obviously much benefit to the patient.
The ambulance crew have driven the man to the village green. It's becoming a landing pad for Harry.
Visual.
So have you got
this side, DCA's on this side of it. Doesn't look like the flattest village green I've ever seen.
Oh yeah. I've landed there before and that's why they've picked up.
Yeah, I'll go right next to where they are.
AS99 visual for landing.
The team's arrival brings a hurricane-force wind that can cause real damage.
The plan is to land where the DCA is now. I'm hoping the people with the motorbike have got the sense to move it out of the way now. There's a quad bike, so it'll be a bit more stable than advertised. Decision point there. Okay, how much blossom left on the trees, I'm afraid. Am I well clear of them, Lisa?
Yeah, I'm just watching. You're alright.
Bench has just gone, but it's stable.
Thank you. Yeah, happy with that.
We're alright, you side it. Yep, you're okay.
Okay, the ground looks relatively flat, although it does slope down to us from the right.
Good left.
On the picture-perfect village green, a pensioner has been overtaken by a life-threatening blockage in his brain.
We'll get door shut.
Right, copy, doctor. So 1200 hours.
Yep.
The cable wells, dizziness, left-sided temporal headache, pins and needles felt down his left-hand side.
Okay.
Peter Cockburn-Metcalf runs the local filling station.
On examining this gentleman, he's pass pointing, he's uncoordinated on his right hand side.
Okay.
Pain score 5 out of 10.
Okay.
Peter's healthy for his age, but until he's received hospital treatment, his life is in real danger. On a village green in the Dales, the team are preparing to fly 74-year-old stroke victim Peter to hospital.
Pete, my name's James. Obviously, you're going to come with us in the helicopter. How do you feel with your leg? Do you think you'll be able to walk out to the aircraft door? Yeah?
We'll see how we get on, Pete, yeah? Somebody hold me, I think I'll be
Oh, we'll start. We've got plenty of hands that can hold you either side, that's fine.
His stroke was detected by his family.
I know it's easy to say, try not to worry. Start and have a steady walk, boss. Nice and steady. How do you feel stood up?
Give yourself a second.
Dizzy? To the point where you're going to fall over, or? You okay?
Sure.
Nice and steady.
Peter's son and wife Margaret are anxiously awaiting news from the paramedics.
Nice and... Ulcer? Okay. Oh, so... Okay.
He's actually been down to the doctors because he has an ulcer on his leg, so he doesn't walk very well as it is. And then, well, son came and said, he's all right, his dad, but he's had a bit of a do and think he may have had a slight stroke. So that just put me into panic mode.
It's a bit awkward to get you in, but we're going to get your bottom on there and then we're going to lay you in because we need to get head first in, all right?
It's full of life, really. He still works, although he's 74.
So if you lay down first, that's
right
it.
down.
Excellent, and then if you use your feet, just see what you can do yourself, that's brilliant.
Rest your head right back.
Time is not on Peter's side.
Okay, I'll be lifting, no turn, it'll just be straight up into a helipad departure. I'll be in the back, James.
Yeah, all good, thank you.
Car's coming in.
S99 lifted route in James Cook.
Herbert 99, that's all received.
Peter's lived his whole life in Wensleydale.
Okay, Peter.
His survival could depend on this 50-mile flight to Teesside.
Obviously, with Peter's symptoms, what we want to do is get him to hospital as quickly as we can. So, one of the downsides of living in rural North Yorkshire is obviously quite a distance to specialist care if you need it, and the helicopter comes into its own really from Bainbridge to Middlesbrough. We're looking at about a 20-minute travel time by air, whereas that could be at least an hour, if not more, by road. So obviously, from a patient benefit point of view, that massively impacts on outcomes and can be potentially life-saving in various circumstances.
A specialist stroke team will take over Peter's care.
Are they meeting you in ED, James?
I believe so.
Right.
7 minutes to run. Wind as it is, we'll go around the back and come over the car park and in from the northeast.
Okay. Ed S99 finals, James Cook.
Patient's just vomiting again, but I'm on harness.
Roger.
Antiemetic's not done out for him, has it?
No.
Peter's condition appears to be deteriorating.
As soon as skin's down, I'm going to come off harness, that's alright.
Yeah, I'll just tell you as soon as the lever's on the deck, mate.
That's fine.
Okay, lever's down, James.
Yep.
How are you doing, Peter?
Fine, thanks.
There's a bit of vomit in that bowl, so just beware as we wheel him out.
To work best and protect brain function, clot busters should be given within 3 hours of a stroke.
So arms in again, boss. Watch your head. Good man. Nice and flat.
In Peter's case, the clock is ticking.
Ready? Steady. Lift.
Strokes can devastate lives, robbing victims of the use of arms and legs, or even the power of speech.
All right.
Yeah.
Excellent.
The treatment he receives in the next hour could affect the rest of Peter's life. At RAF Topcliffe, the crew of Helimed 98 have a mission to an isolated farm in North Yorkshire.
Hi mate, I've got a job for you. Yeah, you're going towards Grantley at Ripon. Yeah, it's a query open fracture. The patient's been kicked by a horse in the knee. Alright mate, bye.
Engines both too flat.
They are on the guard.
A firm and brief.
Okay, be a helipad departure with light winds across the airfield.
Paramedics Sammy and Pete will be there in 6 minutes.
So, we had reports this lady's been kicked by a horse and she's got an open fracture to her lower leg. And obviously the amount of force that you get from a horse kicking you will be quite high.
The patient dialed 999, but her location is sketchy.
Well, that looks like the crossroads with the track going up to the horse.
So this is the grid is this junction in low in the 1 o'clock. So I've got like an equine type facility out there to the right in the 3 o'clock. Chances are it's around there, do we think? Yeah, they're waving to us. Yep.
Oh, you got visual.
Pilot Harry is aiming to touch down in a riding yard, owned by the patient.
Nice green paddock here.
No obstructions if you miss the gate that you're just coming over. Horses are running with an open field.
Roger. Leave us fully down, you're clear to go, Pete. Cheers, mate.
Pete's going prepared for a serious fracture. Some can be life-threatening.
Have I come the right way?
Keen rider Izzy Munyard was looking after 6 horses.
I managed to get the boot off and just cut her trousers back because it was bleeding through. Yeah. It was a bit of shock when I got here, but I kept her warm.
Okay, brilliant. Hello, Izzy.
Hello.
My name's Pete.
Izzy used her mobile phone to call her friend Tal for help. She's a midwife.
Right, what's been happening?
It's just a bit of a scratch.
A bit of a scratch. I hope it is. I'm scared at sight of blood. Right, so what's actually happened, Izzy?
Just shit kicked me.
Right. Which one was it?
The little grey one with the blanket on.
No, can't see it now. All right. Has it got you anywhere else?
No, literally just the once.
And you were standing?
Yeah.
I can't see any evidence that it's broken at the moment, but then, as you can tell by my glasses, I'm not that good at looking at things anyway, so I think it's probably an idea for you to get an X-ray at the very least.
It's close to freezing, and the cold could be affecting Izzy, but it doesn't look like the serious fracture they feared.
So what I'm going to do is going to pop a heated blanket on your tummy. Yeah, with a few choice, I can imagine.
98, job description as passed, female kicked by horse. We don't believe it to be fractured, but pain management ongoing.
Izzy's feeling more comfortable, thanks to the gas and air.
Do I want some?
Can't go crashing it out. Not that kind of organisation.
Like sharing.
Yeah.
The team are preparing her for a road journey to the local hospital. It doesn't look like her injury is serious enough for a flight to a major trauma centre.
There's no tenderness when I squeeze a tin food together.
Right, should we just come away from this wood now, then we can actually lower it down. All right, well done. Relax, relax.
Izzy was alone when it happened. It was lucky she had her phone with her. Without it, she could have lain here for hours, and it'll soon be dark.
All right, Izzy. If you lift this leg up a minute and kind of shuffle yourself over if you can.
The local ground ambulance crew will take her to A&E.
That's marvellous, that.
So it's only 10 miles to Harrogate from here. To be fair, the injury that she's got a small puncture wound sort of just to a tibia area, but it doesn't appear to be any major fractures going on, although it's a good idea to get x-rayed because it's very tender in the bone area around it. But she's been able to mobilise out the field. Probably called a friend who thankfully was medically trained as well, so she did a great job of exposing and examining and dressing the leg.
Until she's been x-rayed, no one will know if a bone is broken. But infection is a serious risk.
There's no sort of red flags that's jumped up or out. So.
Going to
Harrogate. Yeah.
Take care. Cheerio, Izzy, all the best.
Few of the paramedics ride, for good reason.
I think horses are a bit of an obsession with some people. I mean, yeah, they're pretty to look at, but they are quite big and they've got very powerful legs. And the amount of people that have fallen off them, been kicked by them, been crushed against something by them. I think equine accidents are one of the biggest details that we go to.
At Harrogate Hospital, doctors discovered Izzy had a very complex knee injury, something she quickly realised herself after her accident.
I thought I wasn't too bad, but when I tried to put weight on it and had to walk up the hill, I realised that actually there was probably more damage than I thought.
Her leg turned out not to be broken, but she needed surgery for severe tendon and cartilage damage. She's very grateful to her friend and rescuer, Tal.
She got there and found me on the floor, and I said, "Don't worry, I'll be fine. Just stick me in a wheelbarrow." She said, no. Managed to get my welly off and cut up beautifully the side of my jeans. And she said she saw the inside of my knee. So the pony kicked me just here, just between my kneecap and my welly, and I thought I'd got away without any damage at all. But unfortunately, the nail in his shoe went all the way down to the bone, which was the major issue.
Happily, Izzy's now back on her feet, but it wasn't an easy recovery.
I was in a leg brace for a while, which masked the fact that actually underneath the kneecap some of the cartilage had fallen down. So when the ligament mended itself, I was still in pain, so the surgeon said it's the cartilage under the kneecap that needs sorting out.
For 6 months, even walking the dog was agonising. Then she underwent surgery.
Since the operation, I've been able to ride the ponies again. I've been able to play with my poodle puppy again, which I'm sure she's very thankful of, and take her on slightly longer walks rather than just round the block. So it's lovely to have my leg back again.
Her accident happened in a very remote place not long before dusk, and she's very grateful to paramedics Pete and Sammy.
So when I saw the yellow helicopter, it was a huge relief because I thought no one would have been able to find us otherwise. Without them, I think I'd probably still be in the field or in a wheelbarrow.
This is 83-year-old Joyce, around 4:45. She's crossing the road and hit by a van.
Sadly, doctors lost their fight to save 86-year-old Joyce, who was knocked down near her home. Her family say she was fiercely independent and only caught the bus that day because an arm injury meant she couldn't drive.
He's been going down a motorbike about 50 miles per hour, hit some mud, not moved since.
Miraculously, biker Ryan escaped with severe bruising. Although he was confined to bed for a week, he now commutes by car.
So we'll sit you on the edge of the stretcher to start with. We'll give you half a minute just sat there, boss.
And Peter, the filling station owner struck down by a sudden stroke, recovered well and returned home to the Dales. But he's now halved the number of hours he works.